Today is the last, but one day. God willing, tomorrow we'll be wrapping up everything. It is still not too late for one to join. So if you know someone who might be interested in having the CPD points, please let them know. We have the recorded version and we'll make it available to them to listen and also take advantage of the last minute CPD. Tomorrow, we are thinking of having the session rather in the morning from 9 a.m. because we'll be wrapping up tomorrow, God willing. So I don't know, depending on what majority will agree on. If you agree, we can have it from 9 a.m. to when we close. I don't know if that is okay by you. Is that okay by majority? Because tomorrow is Saturday, so we may as well just have it in the morning and be done. Is that okay by majority?
Yes, I'm okay.
Yes, I'm okay.
I'm also okay.
I'm also okay.
Okay. So by the sample size, 100% have agreed we have it in the morning tomorrow. So God willing, tomorrow it shall be in the morning. So Dr. Asian has already taken position. So I will hand over to him without making so many remarks. Thank you very much. Doc, if you are ready, you can take over.
All right, thank you very much, Alhaji. And good evening to you all. Please, can you see my screen?
Yes, please.
Yes, please.
Great. All right. So yesterday, we attempted looking at some topical issue in healthcare. We're looking at clinical communication. And then we also talked about the obstacles and how the environment, amongst many other things, can affect the way we communicate with our clients, the way we communicate with each other, and the things that we need to do to improve upon communication. Today, we also want to look at one other issue that is becoming very, very common amongst healthcare workers, which is the issue of conflict. What I'm going to attempt to do in the next 1 or 2 hours is to look at the types of conflicts that are likely to arise at the workplace, how to identify these types of conflicts, and then how to mitigate these types of conflicts, and then the importance of resolving conflicts, particularly within the healthcare team. So as a background, I would say that conflict resolution is a very important aspect of our practice because it allows us to collaborate well with each other. And more also, it allows us to collaborate very well in an environment where the patient is number one, where the patient becomes priority. So anytime you hear conflict resolution, you're looking at where the environment is so toxic, where the environment is not conducive enough for colleagues to work together because there's some form of disagreement or there's a challenge with something or any issue of that sort. And when this happens, you realize that because two of us have a disagreement, if both of us are supposed to work in the best interest of the patient, it becomes problematic. So at its core, conflict resolution usually would address issues resolving disputes or disagreements amongst individuals or groups in a manner that would promote a very good understanding, cooperation, and positive outcomes within the work environment. But without doing these things, the difficulty and the danger is that because we have disputes amongst us, because there's disagreement amongst us, it may make it difficult for us to work together. It would make it difficult for us to share ideas together. It will make it difficult for us to even focus on the needs of the patient. And so it is very vital. And if you look at the healthcare settings in general, there are so many things that can bring about conflict. Sometimes when communication breaks down, there's conflict. Then you hear colleagues remark, but why didn't you tell me this? But you should have told me this. But why didn't you say this? But you could have left a note. Sometimes even in allocation of resources, when there are resource constraints, conflicts come about. And so there are a number of things that point to the potential of a disagreement or a dispute that can affect the patient. And when it affects the patient, in a lot of the situations, it is not only the patient, the team dynamics is also affected. And in eventual effect, the overall effectiveness of the organization also becomes affected. So nobody seems to understand what is happening. Two people who are supposed to get something done so that all of us can get the things done are not talking to each other, or they are not seeing eye to eye with each other. And so there is that difficulty, particularly even at the organizational level, to get things done properly. As I mentioned earlier on, in this discussion this evening, I'm going to try to unravel the issues around conflict so that we can understand the importance of conflict resolution, the strategies that we can use, the challenges that some of the strategies present, so that we can maintain a harmonious work environment and ensure that the patient is taken care of. In all this, I would always say that the patient is central. The patient is more important. So if there is anything we want to do as medical laboratory professionals or as health workers, let us not forget the fact that our patients are more important than any other group. Now, some definitions. If we talk about conflict resolution in the context of healthcare, we're looking at, number one, a very structured process of managing and resolving disagreements or disputes amongst professionals, amongst different teams, or between the healthcare provider and the patient. Now, conflict resolution is a structured process. That is what a lot of people don't understand. When two people have a disagreement, and then you step in, and then you say, oh, it's okay, you stop talking. You know what? The matter ends here. That is not conflict resolution. You haven't resolved the conflict. By definition, it says that it is a structured process. It means that there is a systematic way of doing things. And this systematic way involves a number of things. You need to identify underlying issues, and then you end the communication there. You haven't done anything. You haven't resolved the conflict. If there's dispute between someone and another person, and you don't find out the root cause of the dispute and how that dispute can be dealt with, then you are likely to miss out on the resolution process. So one of the structured things that is entailed in conflict resolution is the identification of the underlying issue. Once you have identified the underlying issues, then the next thing would be to have an open conversation about the issue. This is where you allow both parties to talk. You know, this one will say this, the other one will say that. You listen to both parties. And then you now would implement strategies to reach a mutually acceptable resolution. So in conflict resolution processes in healthcare, these three issues or these three things are very vital. You need to understand the underlying issue. You need to identify the root cause of the problem. You need to encourage each party to speak up. And then you need to develop a strategy that would allow both parties to accept that, yes, we want to put our differences aside and want to resolve this issue. So effective conflict resolutions would not only address the immediate concerns, but would also contribute to a certain culture that encourages collaboration, shared decision-making, and continuous improvement. Once this approach or this structured approach is done properly, everybody is encouraged. So we'll collaborate more. So we'll share ideas when it comes to decision-making regarding the patient. And then you realize that as individuals, we improve. And we improve in the way we do things. It is important to resolve conflict in healthcare because unresolved conflict can lead to compromised patient safety. I have a problem with my colleague. I have a problem with the boss. I have a problem with the system. I got a scholarship to go and study. The system says they won't allow me to go because I am not due. So there's conflict. There's dispute between me and the system, the organization, another colleague, colleagues from another department. It can easily lead to compromising the patient's safety. It will reduce the morale in the team. Imagine that two of the bosses or two of the senior people are loggerheads with each other in the lab. One of them is my friend. The other one is also my friend. Or this one is my friend. The other one, I am not too close with the person. If you're not careful, you are aligning with one against the other. Or because this person is your friend, the other person may think that you are aligning against him with the other person. The morale in the workplace would go down. This person is not talking to that person is not talking to that person. The morale will go down. It will hinder effectiveness of the way things are run in an organization like that. So it is important that we understand that, look, one of the things that would bring an organization down is unresolved conflicts. Number two, you see, we work in an environment where we encourage collaboration amongst different groups of professionals. We encourage collaboration amongst ourselves. So there's a hematologist, there's a pathologist, there's a microbiologist, there's a biochemist, there's somebody here, there's somebody there. We work together as a team and with a lot of collaboration. Conflicts may arise due to differences in perspectives. Sometimes the values we uphold, or in a lot of the situations when there are competing priorities. When one person is looking to be ahead of the other. When one person wants to be ahead of the other. One of the things that people usually forget is that the workplace is a place of competition. You say that, oh, there's no competition at the workplace. There's no competition at the workplace. But the competition at the workplace is that we are all striving to give our best. And all of us at one point or the other would want to lead the team. So when there are competing priorities, it can bring about conflicts. And these competing priorities, the differences in perspectives, the differences in our moral values and ethical conduct would affect the way we collaborate with each other. One other importance of conflict resolution is that it improves communication and enhances overall quality of the patient's care. You see, when communication improves, it creates an environment that fosters teamwork. I understand that I need to do this. My colleague also needs to do that. So I'm talking to him. If I have challenges, if I have difficulties, I'm asking him. He's providing answers. He's giving me directives. He's more senior to me. He has a lot more understanding of this procedure than I do. So I'm able to communicate with him. I am able to go to him and say, oh, senior, you know, I've been trying to do this. I am having some challenge doing this. That communication would create an environment where there will be teamwork, where now people would come together and say that, oh, yes, we are able to collaborate properly for good patient care. You see, the ability to navigate conflicts positively also contributes to our emotional intelligence and resilience. If you have conflict with colleagues, if you have conflict with the system, and you are able to deal with this appropriately, it builds you up in terms of your emotional intelligence. It builds you up in terms of your resilience. It creates certain traits in you such that in the face of challenging and often emotionally charged atmosphere, you're likely to be the calmest one. You're likely to be the one who would say that, no, let us not do this. It would affect us. It would affect the patient. It would affect the organization. So one of the major importance of conflict resolution in healthcare is that it builds us as individuals up emotionally. It makes us resilient, such that in a situation where there are issues, we would be able to deal with them. Now, there are several types of conflicts, but the common ones usually would include the interpersonal conflicts, which are conflicts between one person and the other, or to a large extent, where someone is conflicted with himself. Intrapersonal. There are people, they don't have a problem with anybody. Their problem is with themselves. So they are moody. So they don't want to talk to anybody. They have some conflict within themselves, about themselves. It's not about anybody. So when you ask them, have I done anything to you? They say no. Has anyone wronged you? They say no. But why are you angry? So I'm angry with myself. We have disagreements within interdisciplinary teams. Sometimes tensions that arise from hierarchical structures can bring conflicts. Not too long ago, in a facility, there was vacancy, and then one person needed to be promoted. There were 3 people who were eligible for that position. It created some tension amongst the 3 people. It eventually resulted in conflict amongst the 3 people. When communication breaks down between us and our patients, it can also result in conflict. You know, one of the seemingly subtle ones is when there are differences in our expectations, when there are differences in our outcomes. So I came to work late yesterday. My boss scolded me. Kojo comes to work late today. My boss did not say anything. That can create conflict between myself, my boss, and even Kojo. Because of the differences in expectations. I feel like, okay, if you come to work late and you get scolded, then if anybody else comes to work late, they should be scolded. That is my expectation. But if one person is scolded and the other is not, then it raises questions and then it brings conflict. Sometimes when there are misunderstandings about treatment plans, when there are resource allocation conflicts stemming from limited budgets or availability of essential resources, it can bring conflict. So, colleagues, a nuanced understanding of these conflicts is very important. And more importantly, it is what would help us address these conflicts with the needed strategies and the dynamism that we need. I'm going to ask that in the next 3 to 5 minutes, I want you to share your experience with me with the types of conflicts that you're seeing on your screen. Maybe you've seen some happen. Maybe you've experienced some. I want you to share your experience with us. For any of the conflicts, the 7 conflict types, the 7 conflict common types that we've listed. What is your take on it? Have you ever experienced any of it? Have you ever seen any of it happen? Let me hear from you, please. Yes, Mutala.
Yes, boss.
Hello.
Alimatu. Oh, any of us can share, please. Let's make this interactive. You know, I like to have interactive sessions like this with my colleagues because I feel like if I'm talking, it will sound as if I'm giving a public lecture. So let's make it interactive. It could be a question, it could be a contribution. The types of conflicts. Any practical examples you want to share? Beatrice, Diana, Vincent, Alima, Daniel, Robert, Eugene, Francis, Frank. Yes, anyone wants to share with us? Yes, Daniel. Alaji, today my people are not talking. Oh. Can you hear me?
Yes, very well.
Okay, so let me also hear from you, please. Can you identify with any of the conflicts? Have you ever seen any of this? Where differences in expectations have resulted in conflicts? I want you to share with us where disagreements within interdisciplinary teams have led to conflicts. Okay, I guess we'll make progress. Now, what are some of the causes of conflict in healthcare? They usually would arise from a combination of factors. And these factors may be multifaceted depending on the nature of the establishment or the industry. But one prominent cause is communication issues. When people do not communicate well, and that is why I am happy that yesterday we looked at clinical communication. We looked at all the issues relating to communication yesterday. But one prominent cause is communication issues. You see, and this actually encapsulates misunderstanding and lack of communication strategies. If we have communication issues, the first and foremost thing that is likely to happen is that we may misunderstand each other. Is that we may misconstrue the information that we have heard. Oh, you said this, I didn't say this. You said this, I didn't say this. So why did you tell this person this? Why couldn't you tell me? So all these apprehensions are usually very prominent causes when it comes to conflicts. And you know, misunderstandings generally can occur even between patients, even from interactions with our patients, even among our team members. Sometimes because we haven't communicated properly, the patient is a male. Meanwhile, you've written female or you didn't indicate. So I didn't know whether it was a male or female. So I didn't adjust my parameters on the analyzer. And now you're accusing me of wasting reagents and not getting you the right results. You didn't put in the right test request. I am done with the test. And now you're saying that we've wasted resources. These misunderstandings usually between us or even among team members between us and our patients, potentially are likely to compromise the outcome of the tests that we run. There will not be any coherence. This person who has the information about this patient will do it. With whatever information is available to me, I'll do it the way I want. And so for the same patient, because we are not communicating, because we are not talking to each other, because there's some seeming disagreement or dispute amongst us, then we are likely to have different outcomes. So you realize that in establishments where there is the absence of robust communication strategies, where we do not have systems that disrupt the withholding of information such that information is timely exchanged critically for action to be taken, then it will lead to confusion and then conflict would escalate. So you would agree with me that in situations where we don't create systems for effective communication strategies, then you realize that vital information that needs to get to the patient or the other team member or your colleague may not have gotten to them at the right time. Then before you realize the patient is dead, then this one is blaming this person, that one is blaming that person, that one is also blaming that person. Once this escalates, it leads to greater conflict. Another significant contributor to conflict is ambiguity, where individuals may experience uncertainty about what they are supposed to do, what sort of boundaries they have, and things like that. I am not too sure if I am the one supposed to be doing this. I'm not too sure if he's the one supposed to be doing this. So where there's an overlap of responsibilities, it creates misunderstanding. Where there is an ambiguity as to who should make the decision, as to whose authority we should rely on, then you realize that it will create misunderstanding. And when something goes wrong, conflict would definitely occur. It is important that we have to clarify roles. In one of the public engagements that I had recently, where I was talking about professional boundaries in healthcare, I emphasize on the need for role clarification amongst us and how this need is important for mitigating conflicts that arises from the ambiguities. So that you see, in a particular setup, you have a very streamlined way and a very efficient way of delivering healthcare. A knows that they are supposed to report to B. B knows that they are supposed to report to C. C knows that they are supposed to report to D. So it is very clear. A knows that if B is not around, I cannot go directly to C. I have to wait for B to be around before, if he or she is unable to deal with the matter before I go to C. Once these structures are put in place, there's no ambiguity at all. Everybody is clear in their mind who is to do what, who is responsible for what, who should be acting at what time, and who should not be acting at the other time. So things become very well streamlined. Another cause has to do with resource allocation, as I mentioned earlier on. You see, in the era where we are constrained with a lot of resource issues and budget constraints, it is very difficult to keep everybody on the team running. The resources are limited. We're constrained with how much funding we have had. How do we make sure that the small resource that has been allocated to us is shared ethically? Do we have to share it evenly? Do we have to give everybody the same, or we share it according to need? Do we have to prioritize today one unit or one department over the other? These are things that can bring potential conflicts. You see, as you and I would know, the healthcare industry is usually faced with these challenges. Now, we have a lot of people that are leaving on daily basis. People are writing foreign licensing exams, and the next moment they are gone. Recently, I participated in a meeting with the Society of Medical Laboratory Managers. And one of the things that they interrogated was equipment shortages, how some facilities are struggling, and how people are taking advantage of some of these things to create a competitive environment for resource utilization. There are some facilities where colleagues will go to work and then there's actually nothing to do. So they just sit and wait. And then there's conflict because somebody comes and thinks that, oh, you are here, you are not doing anything. At the end of the month, you get paid. The equipment is not working. So what do you expect me to do? There are resource gaps. You see, when professionals are forced to make difficult decisions about how to allocate scarce resources, it usually will lead to tension amongst the team members. And it will raise potential ethical concerns. Every one of these days, I'll tell Alaji we'll do a free session on dual loyalty and resource allocation. And then you understand that there are different approaches to how to allocate resources. But if you don't have an understanding of how this is done, whether you're going by the utilitarian approach, whether you're going by the Kantian approach, or the other approaches, then you are likely to miss the point and create tension between team members, which are likely to result in conflict. You go to a lot of establishments and institutions, there are no resource allocation policies. They are not followed by anything. So if I am the leader and this month or this year, you have been very close to me, you're my friend, when the resources come, I'll look into your corner first. Sometimes it is because we don't even manage our budgets properly. We don't draw up our budgets properly. So we forgot to include some things in our budget. So we submit the budget is approved. And then the resources come. And then later on we realize that we have to do this, we have to do that. Then it becomes a problem. So effective budget management could also be a cause of conflict. We cannot talk about conflicts and not talk about the differences we have as individuals based on our culture and our religion. There are numerous ethical frameworks that emphasizes that cultural backgrounds, personal beliefs, and religion usually leads to disagreements at the workplace. Depending on what ethical frameworks you believe in, depending on what cultural backgrounds you have, there may be some tension between you because of what you believe in and what, even to a large extent, your patient does not believe in. And so personal beliefs usually may lead to disagreements regarding treatment approaches. Sometimes patient care decisions and other things are compromised because of the values that we hold. Oh, my religion says that you cannot perform this procedure. My pastor says that, oh no, you cannot have a cesarean section. We should all deliver normally by vaginal delivery, normal vaginal delivery. But the baby is not positioned well. We need to take off the baby and save the mother. That could bring about potential conflicts. You see, when organizations do not develop what we call an organizational culture, where the organizational culture thrives beyond our individual cultures, then it becomes very difficult in the way we shape behaviors at the workplace. One of the things that every organization should be aspiring for is to create a certain organizational culture that would inculcate values of open dialogue, cultural competence, training, understanding diversity and different perspectives from other people into the work environment. It is only when we have some of these things that we can say that we've created an organizational culture that encompasses everybody, that attempts to deal with conflicts. That culture would usually promote open communication, promote collaboration, and usually would get members to commit to doing certain things. Now, there are some categories of conflicts. I mentioned the interpersonal conflicts. This first category can manifest between healthcare practitioners, doctors, nurses, us, supporting staff, etc. They arise from differences in communication style, especially where one sees himself to be superior over the other. Sometimes when a professional expectation is not properly communicated between the groups, it can bring about conflicts. When we all have varying approaches to a particular patient care, but we don't communicate it, we think that this is wrong or that may be wrong. I remember as a young intern, I worked in a facility where they were conducting a test and the procedure was different from what I was taught in school and what I knew in the textbook. My first inclination was that these people are wrong. These people don't know what they're doing. I was so angry. But somehow, somewhere, I found myself talking to the boss. And then he smiled. I said, no, but the way you guys are doing this thing is not right. That is not how it is done. So is this what you have been doing all this time? And then he smiled and he said, come. And he took me to the bench. He said, okay, I want to explain something to you. This is the reason why we do ours this way. This is the principle behind it. If we do this and we do that and we do that, it lessens the amount of time we had to wait. And the outcome is better. So in the next 2 hours, I'm going to give you the opportunity to go with what you know in the book and what you were taught. And then also follow our protocol. And then when you're done, you and I will do the evaluation together. I agreed to the challenge. I took it up. I used both protocols. Lo and behold, by the time I was done, their protocol was way, way, way superior. This could have actually led to some tension between me and them, because they had a different approach to the way we were doing things, but it wasn't communicated. The reason behind this different approach was not communicated. So you see, to have a cohesive workforce, more importantly, if you want to remain focused on providing optimal care, you need to learn how to manage interpersonal conflicts. Because you see, it helps you in maintaining a very good practitioner-patient relationship, and then also a very good practitioner-practitioner relationship. This first category also includes people who are conflicted with themselves. Oh, I could have done this way. I could have saved this child. And then they are angry with themselves. They don't want to talk to anybody. They don't want to even reason with anybody. And then they want to shut everybody off. This is one category. Category 2 is a team conflicts, which encompasses disputes within the interdisciplinary healthcare teams. Usually, when there are diverse specialties and roles, these specialties and roles usually face challenges when it comes to collaboration and communication. Those of us who work in institutions where we have units or departments, where patients would get to move from one unit to the other or one department to the other, If we don't collaborate well, if we don't communicate well, it could bring about team conflicts. These team conflicts may be differences in opinion. Sometimes opinions are just divergent. Sometimes they are philosophical. My philosophy is I believe in this more than this. When there are inadequate clarities in terms of the roles of the persons involved, there may be conflicts. When you see in an establishment, when you have issues with how teamwork needs to be built, especially the hierarchy amongst the various layers of the team, if you don't have team conflicts, there are power differentials. Oh, you are an MLS. Me too, I'm an MLS. So what? You are a TO. Me too, I'm a TO. So what? You can't come and instruct me. You know, maybe I have more years of experience than you. But maybe for you, you were in that facility before I came. So you are the head. I was a year ahead of you in school. I was 2 years ahead of you in school. We are all the same. We are all of the same level. Those power differentials can bring about team conflicts. If we don't know who is doing what, who has the right to do what, who has the right to do what. You know, I'm the one who is supposed to sign the results. So why are you giving the results to this other person to sign? You know, I'm the one supposed to endorse the results. So why are you giving this to this other person to do? But I told you if I'm not around, leave this for me. I'll come and do it. Those are some of the things, my colleagues, that can bring about team conflicts. Before I go to strategies for resolving conflict, if you have any questions, let me take them before we proceed. We talk about the two major categories, the team conflicts and then interpersonal conflicts. We looked at the causes of conflicts. We want to talk about strategies that can be used in resolving conflicts. If you have any questions, let's hear them. Let's take them. Any questions? My people, talk to me. Oh. Any questions, please?
Prof.
Daniel.
Prof.
Yes, sir. I can hear you. Hello, Daniel.
Yes, Prof. Prof, I can hear you.
We can hear you. Yeah, please go ahead. I thought you wanted to make a contribution or ask a question.
There's this that I wanted to say.
Okay.
Like you rightly said, in every organization or any human institution, conflicts are bound to come. But the
Definitely.
way at which we are able to resolve the conflict is what rather makes the changes.
Great.
If the conflict come and we are able to resolve it amicably, I think that work will flow smoothly. But however, if conflict don't normally come and it comes once and we are unable to resolve it, that is what will turn into a big issue. So I think that if systems are put in place adequately to resolve conflict, then we are good to go. It can come, conflict can come in so many forms.
Sure.
It could even be technical power, where you go to a facility where you are all MLS, you all have the same degrees, you have the same competencies. Probably the machine that you went to meet at your place, the one who was there was much more conversant and feels that if I'm able to take you through the equipment, you'll be like me. And so he will not even let you come near it, let alone
Exactly.
to operate it.
Yeah.
I'm
Yeah.
saying this from an experience where
Sure.
our head of department felt that once you know everything and you can work without her, then her role as the head will be shaken. Fortunately and unfortunately, it was a private place, so she decided to harbor the machine, to keep the machine to herself. And no one at that time could run hormonal assays at her place until one day she fell sick. And we needed to run some tests on her. And unfortunately, we didn't know how to run it.
That is it.
So
That
it
is
was
it.
there that it was pointed out to her that a good leader is not the one who knows it all, but knows how
Exactly.
to bring out the best out of the colleagues. So this
Thank
a
you
lesson
very
that
much,
I can
Daniel.
share.
Thank you very much. I really appreciate the insights, and I like this. It's a very common thing. Emmanuel Amangwa. Hello, Emma. Can you hear us? We cannot hear you. Your mic indicates you're speaking, but we cannot hear you at all, Emmanuel. Okay, I'm sure we'll make progress, and then once we can get Emmanuel connected properly, we can take his question or comment. Alima.
Good evening.
Good evening.
I think the best way to resolve conflict is just an opinion. The best way to resolve conflict at work site, we have to let the communication between us be effective. I think with communication, like Ashanti, they can insult you, but the way they will frame it, you later you realize it's an insult. So I think at our workplace, we are able to let the communication flow. Let your colleague understand what you are saying in a polite manner. It will help. Thank you.
Thank you very much. So Alima has set the tone on our strategies for resolving conflict. Colleagues, the fundamental approach to resolving conflict is through effective communication. And I'm happy that yesterday we talked about communication. I remember in our discussion, we talked about active listening. We talked about making eye contact, reading body languages and gestures. So you see, the fundamental approach to resolving conflict is effective communication strategies. You need to understand, you need to empathize with the perspective of others. You see, in healthcare settings, and in the hospital especially, we need to listen more than the way we talk. As professionals, we need to listen to other people's viewpoints on things and how these viewpoints are communicated clearly and openly will be very important in resolving conflicts. You look at the examples and the causes that we talked about, largely has to do with how we communicate. So when we openly share information, concerns, and expectations especially, and this is where a lot of us fall short, are expectations. You're working together with some other people. Have you communicated your expectations to them? So at what point have you told the entire team that, guys, today, my expectation is that we'll be able to finish with all these tests and then clear the backlog before we go home. So everybody knows that that is our expectation. You haven't told anybody. It's time for us to go home. Say, no, we need to clear the backlog. It will bring about conflict. So the number one strategy is effective communication. Once we engage in effective communication, we're good to go. Then we need to also employ what we refer to as a collaborative problem-solving approach. You see, in collaborative problem-solving approach, basically what you do is that you identify the root cause of a conflict. And that is particularly important in underlying all the issues. You know, you take all the issues apart. Also, this is the reason why he was angry. So you don't know why this person got angry with you. That is the reason why he got angry and things like that. This collaborative problem-solving approach would make you examine all the factors that are contributing to the conflict. Issues relating to role ambiguity, communication breakdown, resource constraints, maybe someone said something, emotional issues, and things like that. So once the root cause has been identified, you can engage in brainstorming the solutions that you want to apply, and you want to apply collaboratively. So you realize that if you bring the parties together, and then you try to resolve the conflict by understanding the root cause of the conflict, you already would have created an opportunity for the two people to talk, to communicate. You already would have created an opportunity for each of them to feel responsible for the resolution process. You already would have created an opportunity that would lead to solutions that will not be one-sided, but that will lead to solutions that will be seen healthy by both parties. And this is why it is very important, particularly to use the collaborative approach. Another approach is the mediation. Especially in situations where direct communication has proven challenging, that you need to mediate. Where you want to engage the two parties so they have direct communication, and you realize that no, it is not likely going to happen. Your only solution is to mediate. And in mediation, you need a mediator. So the mediator's role is to make sure that he will facilitate communication between the conflicting parties and guide them towards a mutually acceptable resolution. Mediators usually are either trained professionals or individuals that are appointed for their impartiality or, to a very large extent, their communication skills. There are people who know how to talk. So when you elect them or select them as mediators, they know what to say to this party and they know what to say to that party to make them calm down and then agree to communicate. Usually neutral third-party involvements are also helpful in mediation processes, because this neutral person may ensure that there's an unbiased resolution. They would ensure that there's an unbiased perspective, and they would ensure that everybody or both parties have expressed themselves, have expressed their misgivings, and then the issues are resolved. Mediation usually helps to create a very structured and supportive environment, especially when you have to rebuild an organizational structure in its totality. When you have to rebuild a relationship in its totality, the best approach is to use a mediation, where you have a mediator whose role or responsibility would be facilitating the two parties to come together and talk. Sometimes you can also establish a formal conflict resolution process. What do you have to do? You need to define the steps. What steps are you going to take? You need to outline the structured approach through which you want to resolve this conflict. You need to ensure that all parties that are involved in this resolution process understand the procedure that you're going to use, and then the expectations that you have for both parties. This usually occurs, especially this structured conflict or formal conflict resolution approach, usually occurs between individuals and establishments, or individuals and then superiors. It usually may involve how reporting mechanisms would be done. So we have had a meeting, we've spoken today. I am arbitrating, so I have to go and report, or you have to also go and report. Now, there may be instances where there may be escalations. What procedures do we use? If we want to talk to other people, apart from the people involved, are there designated points of contact? All these things would have to be clear right from the onset. So once you set up a formal resolution, then the other thing is that you need to consider that you need to make it timely. Because you see, the longer you wait to resolve conflicts, the more likely it is to escalate. So if you want to minimize the potential of a conflict escalating, then you need to put a timestamp on it. You need to make sure that within a certain time period, this matter is dealt with once and for all. Whether it is between patients and practitioners, or whether it is between practitioners and practitioners, you need to put a timestamp on it. And that is what a formal or a structured conflict resolution process would give you. Colleagues, whilst I am coming towards the end of our discussion, one of the things I emphasized yesterday, which again I want to emphasize today, is the issue of training. And I like what Daniel said earlier. There may be instances where you work in an organization and for so long a time, conflicts may not come. But the only time conflicts may arise, it may shake the foundation of the organization. So because we need to collaborate with our patients and with ourselves a lot more, we need a lot of training. We don't need to wait for the thing to happen before we are trained. We need to provide healthcare workers with the necessary skills to identify, first of all, to manage, second, and three, to resolve conflicts. I'm happy that we're having this workshop, because through specialized workshops or CPDs like this, we're able to bring some of the things to bear. We're able to talk about some of the techniques and the technologies that are available, especially when we mention active listening, negotiations and mediations and things like that, arbitrations and things like that. Then it helps. The training will not only help us with the tools to navigate conflict, but also it would foster a culture of open communication and understanding between us if we all have this. We need to train and educate people on emotional intelligence. You see, the work environment is very stressful. There's a lot that is going on in that work environment. Sometimes you need reagents and equipment to work with. They are not forthcoming. Sometimes you need some basic things, they are not forthcoming. The atmosphere is emotionally charged because the patients are waiting. The machine is not working. The power is fluctuating. You cannot get a very stable electricity supply. You are angry with yourself. You need a lot of emotional intelligence. Emotional intelligence training would usually help you to understand how your own emotions and the emotions of others conflict with each other, and what you need to do especially in showing empathy, tact, and compassion when your emotion clashes with other people's emotions. Such that in the face of provocation, you can decide that, no, as for this thing, no matter what you do, I won't comment. No matter what you say, I'll just walk away for peace to prevail. We need to have a lot of education. We need to have a lot of sessions on these things. By enhancing emotional intelligence, we're better equipped to manage interpersonal conflicts. We need team building exercises. You know, sometimes at the workplace, you need to develop team building modules where you can get people put together into groups. And more importantly, not the groups they select themselves, but you put them together into groups. And then these groups would work together to ensure continuity, to ensure collaboration, to ensure teamwork. So you foster trust, collaboration, communication. When you bring people together and ask them to perform this task together and report, you perform that task together and report. If you could do this on quarterly basis, for instance, you realize that the environment at your workplace would be super. You mix up the group for the first quarter, the second quarter, you mix up the group, the third quarter, you mix up the group, irrespective of rank or age, anybody at all in the group, you can just ballot and the person will be the leader. The person is the one who would coordinate the activities. That level of team building brings improvement. It contributes to a resilient and a supportive team culture, which would handle conflicts better and in a constructive manner. We're talking about continuous improvement, which is what we're doing now. We need to assess regularly the effectiveness of the conflict resolution initiatives we have. We need to provide feedback. We need to conduct post-conflict resolution analysis. And we need to adjust our training programs or our modes of resolving conflict accordingly. Once you have a specific conflict resolution process, mind you, that resolution process may not necessarily work all the time. It may not necessarily stay astute all the time. Sometimes if you use an approach in resolving conflict between two people, you need to go back and evaluate that approach and see if it actually worked. And this is particularly important for continuity. So to improve upon this, we need a lot of training and a lot of education on how to manage conflicts. Now, I'm going to share with you, and here I put together some case studies. And I want you to be able to tell me whether these case scenarios address interpersonal conflicts or team-based conflicts. As the first one, in a busy hospital setting, conflicts arose among surgical team members due to differing opinion on patient care priorities. So recognizing the need for resolution, the hospital implemented inter-professional collaboration training. The training focused on effective communication, role clarity, and shared decision-making. Through facilitated discussions and simulated scenarios, the team members learned to appreciate each other's perspective. As a result, the conflict diminished, and the surgical team began working cohesively, ultimately improving patient outcomes. What sort of, or what category of conflict is this, and what approach do you think was used here? What category of conflict is this, and what approach do you think was used here? My colleagues, I hope you have not logged on to go and sleep. Let me hear from you. Israel or Isaac, any of you? Agnes, Janet. Anybody wants to share?
Please, attendees, you are all allowed to talk, so you can just unmute and talk. As Doug said, he wants it to be interactive, so let's do that. Thank you.
Thank you very much. Yes, what do you think? Is it interpersonal or team-based conflict? Alaji, my people are not talking. No.
Prof, you are thinking through.
Okay, grateful. In a busy hospital setting, conflicts arose among a surgical team due to differing opinions on how a patient should be cared for. Now, recognizing the need for conflict resolution, the hospital implemented interprofessional collaboration training. The training focused on effective communication, role clarity, and shared decision-making. Through facilitated discussions and simulated scenarios, the team members learned to appreciate each other's perspective. As a result, the conflict diminished and the team began to work cohesively. And then the patient outcomes also improved. I'm asking if you can identify the category of conflict and whether the approach that was used yielded results. Yes, Solomon, please go ahead. Solomon, please go ahead. Yeah, Solomon, I can see your hand is raised and you're muted. Please go ahead. Okay, it's Vincent.
Thank you, Prof. I believe here the category used is the team conflict resolution. How do you call it? The team conflict resolution.
Okay.
And then the case study work like they've been able to how do you call it? Appreciate
Resolve
each
the
other's
conflict.
and then as a result, like work the conflict diminishing and then the work continues cohesively. So in this case, we will say the team conflict resolution worked for this case.
So this looks more of like the collaborative approach.
Yes.
Great, great, great. Thank you very much, Vincent. Thank you very much. Now let's look at the next category, the next case scenario. Now, a patient in a primary care facility experience dissatisfaction and frustration due to a perceived dismissive communication from their healthcare provider. To address this, the clinic introduced training on patient-centered communication. The healthcare providers learn to actively listen, empathize, and involve patients in decision-making. This approach not only resolved the conflict with the dissatisfied patient, but also improved overall patient satisfaction scores and strengthened the provider-patient relationship. What sort of approach is at play here? First of all, let's identify the category and then also interrogate the approach that is at play here. It's Lois, I can see you on the call. Good evening. Patient in a primary care clinic experience dissatisfaction and frustration due to a perceived dismissive communication from their provider. The hospital, in trying to address this, introduced a training on patient-centered communication. So in that training, the practitioners learned how to actively listen, how to empathize, and how to involve patients in decision-making. The approach resolved the conflict. The patient became satisfied, but it also strengthened the practitioner-patient relationship at that particular clinic. What sort of approach or categories at play here, and was the approach helpful? Kenneth, I greet you. Jennifer, I greet you. Anybody wants to help us with the second one? Samuel, my namesake, I greet you. Free Mensa, I greet you too. Anybody wants to help us with the second case, please? Yes, Vincent.
I believe that the resolution used here is the interpersonal conflict resolution.
Excellent, Vincent. Excellent, excellent, excellent. So what it means is that we have understood the concepts that we have discussed so far. The resolution here is an interpersonal category, and that is the type of resolution that was used. Right. That is excellent. That is excellent. That is excellent. So when you get the slides, I've added a number of cases where you can also look at. I think I have 3 or 4 more cases that I added, and then I also put together a review of the cases. So, colleagues, to conclude, I want to conclude by saying that the exploration of conflict resolution in healthcare usually would shed a lot of light on a number of key points that underscores the necessity for addressing conflict in a very proactive manner, especially looking at the complex environment within which we work. Because if you are not proactive, and if you are not going to deal with the conflicts or resolve the conflicts in time, they may escalate. So we have examined the causes of conflict ranging from communication, ambiguity, resource allocation, amongst many others, differences in our beliefs, differences in our values. We've also looked at strategies for conflict resolution, which we have said includes effective communication, the collaborative approach or problem-solving approach, the mediation, and then the establishment of the formal resolution processes and things like that. These approaches, we said from the onset that would have to be very well structured. So emphasizing the importance of conflict resolution is very key in sustaining a very high quality practitioner-patient relationship, which would obviously promote a very good working environment for all of us to be comfortable to work in. Remember that if conflicts are not dealt with, if they are not resolved, it would have a lot of effect on how the patient is cared for, how the team dynamics would coexist, and how much impact it would have on the organizational effectiveness. So we need to invest a lot more in conflict resolution training. We need to promote emotional intelligence. We need to engage in team building exercises. And we need to continuously improve upon conflict resolution strategies. And if you are an owner or a leader in any of these facilities, we would also want to encourage that you create an environment that encourages people to openly communicate, that encourages people to collaborate, that encourages people to share commitment in developing optimal patient care. I'm going to encourage all of us here to pay attention to the culture of the people that we work with, pay attention to the environment we find ourselves, and then we help develop our own organizational cultures. And these organizational cultures would actually help us to communicate properly, so that once the atmosphere is created, every individual will feel empowered to express themselves. People, whether male or female, will feel strong enough to share their opinions. People will share their perspectives. People will not hold on to information which would negatively affect the rest of the team. An organizational culture would enhance the resolution of conflicts. And again, it would also contribute to a very positive work environment. On that note, I want to say a very big thank you to all of you. If you have any questions, I'll take them before we close. Over to you, coordinator.
All right, please, if you have any question, just raise your hand or you can unmute and ask. Vincent, I can see you are unmuted. You have a question, you have proceed. Please, any question, any contribution?
I think it's obvious, Prof. ACN is always very clear and very precise, and I really appreciate his presentation. And that's I'm assuming that is why nobody is asking. It isn't that we are not following; we are following, but I think the presentation is very clear, and we have gotten it. Thanks so much, Prof.
Thank you for the opportunity too.
Okay, if that is a unanimous opinion, I'd like to thank Prof for his time today. And as principal said, tomorrow we are starting at 9 a.m. and tomorrow is the last day. And as he also said, once the training is still going on, which tomorrow is the last day, you can still register. So you can tell your colleagues who haven't registered that they can still register. The slides and the recording of the sessions will be provided for those who have missed. Yes. So thank you very much, and thank you very much, Prof. And see you all tomorrow.
Thank you, and
Thank
enjoy the
you.
rest of your evening. And thank you.
Thank you.